My name is Dr. Randy Bain. I'm a board-certified family medicine physician here at Syracuse Area Health. Before this, I was an Army doctor for 7 years and settled here in Syracuse just over a year ago. Chose to go into medicine, I think, for the same reason a lot of people do, to help other people. But for me, it also turned into an opportunity to learn just as much as I'm teaching and really get an opportunity to be challenged every day with learning new things and just having that opportunity to build relationships with patients. I did my medical school training in Western University in Southern California, and then completed my family medicine residency through the Army at Eisenhower Army Medical Center in Georgia. The people in Syracuse are really why we decided to come here, both at the hospital and just in the community. We were looking at about 4 different places around the country before we settled on this, and really it came down to just the opportunities and the practice setup and just to be part of a community here. My favorite part about family medicine in particular here at Syracuse is just building those relationships with patients, kind of meeting them where they are and building on that relationship to give them their own abilities to make better decisions, to live better lives, learning more about the individuals and getting to meet the whole family. I went through a lot of different specialties before I settled on family medicine, and I think the biggest draw to it for me was just the diversity both in patients and in the types of cases that you're seeing. It takes a different mindset to be able to treat a newborn one day and then an older person the next day, and be able to kind of take care of everything in between, from routine wellness visits to very complicated and sick patients, and still be able to build that relationship with the patient and the family all the way through. So I think it's the constant learning and changing that comes with primary care as a specialty, and then also being able to see all ages. That was the biggest draw for me. I like working with kids the best, yeah. My approach to working with patients is really to create a safe place for good medicine. It's kind of my philosophy, and again, just meeting patients where they are to build that common ground so that they feel empowered to kind of make those decisions on their own. I see my role primarily as a resource and an advisor for patients, to give them the information they need, but more importantly to have someone that they trust to make those decisions with through goodness, through good things and poor health. So the way we're set up here at Syracuse Area Health was also another draw for me. So I spend most of the time in the clinic doing outpatient medicine, regular doctor's appointment type visits, but then also providing coverage in the ER and the hospital side. So it's really a good way for me and for all the providers here really to kind of maintain that skill set in different settings, especially taking care of patients in the clinic. You can then help with that transition of care when they come in onto the hospital side, and then also dealing with some of the more acute things that might come in through the emergency room. The family practice clinic here is just set up really well. I mean, we have most of the resources that we need here to take care of patients without having to send them too far. The support staff, the nursing staff, all the providers are amazing, and we have a really good support from clinic and hospital leadership as well, just to make sure that we're all kind of putting patients first. Our philosophy here really is to try to keep patients close to home, and so to that end we've tried to expand resources here to keep patients out of the hospital, but when they do need to come into the hospital, have most of those services available here that we need. So both from the staff side and the provider side and just the training, the specialists that we have come, and just the network of resources we have in the community, that's really been our goal and my goal specifically, to try to keep people close to home where they're comfortable and keep them in-house.